Welcome to Monday's edition of COVID-19. We're starting the work week on the 700 level despite the weekend factor as contagion spreads in capital Seoul and its surrounding areas. Now we have more on this situation as well as that in neighboring Japan, which has about roughly 3 weeks to the Olympics. We begin now with the pandemic updates. Now, so our daily tally here in Korea is showing little sign of abating.
Yes, Sunny. In fact, we're actually observing the opposite here with 711 cases reported as of 12 a.m. this Monday, and that includes 644 domestic and 67 imported cases. So for 6 consecutive days, we have cases here at above 700. And if we take a look at Monday's figure, we are seeing a clear surge here, and it is for the first time in 26 weeks the highest number for a Monday caseload after the weekend. And Korea now has more than 160,000 cases in total, but also the number of recoveries has now surpassed 150,000. If we take a look at where new cases have emerged, 307 in the capital Seoul, followed by 220 in Gyeonggi-do province. And here in the metropolitan region, we've been talking about the cluster infection linked to foreign language teachers, and that cluster now has hit above 300 in total cases in the past 2 weeks, and it's confirmed that these cases have led to chain transmissions to other parts of the country as well.
Right, so given the rebounding cases, officials over the weekend bolstered their containment efforts for the greater Seoul area here.
Exactly, Sunny. So instead of transitioning into the revised social distancing scheme like other parts of the country, the capital region has actually implemented extra measures, with officials saying contact tracing is becoming difficult in this area, and especially with figures looking like these, according to an official during Sunday's announcement.
The average number of domestic cases stood at 655 last week, compared to 492 the previous week. That's a 33.1% rise. 531 of those were patients in the capital region, which is 46.2% higher on week and accounts for 81% of the nationwide total. The virus reproduction rate also rose from 0.99 to 1.2 last week due to the surge in the capital region.
So as opposed to the rest of the nation, citizens in Seoul, Gyeonggi-do province and Incheon will have to continue to wear masks indoors and outdoors regardless of their vaccination status, meaning incentives won't be implemented in this region for now. Also, drinking at parks and riversides will be banned after 10 p.m. as people have shown to flock to such places past the closing of restaurants and bars. Meanwhile, a recent survey showed that 7 out of 10 citizens see the need for a longer delay in the revision of a social distancing system in and around Seoul. An announcement on which measures will kick in beginning this Thursday is expected on Wednesday. And what we're also expecting to begin this week is the vaccination drive for the second half of the year to pick up speed, including people aged 60 to 74 who were not able to get their shots in the first half of the year, and essential workers aged below 30, and those are all expected to receive Pfizer shots. And cross-inoculation of AstraZeneca and Pfizer doses is also expected to begin this month. And so far, we've got 15.3 million people of the nation's population who got at least 1 shot of COVID-19 vaccination. Now, although not having reached its goal of vaccinating 70% of its adults in the U.S. before Independence Day, U.S. President Joe Biden said that the country is closer than ever to declaring independence from COVID-19, although stressing that the battle is not over yet. And it is far from over in many countries that are grappling with the Delta variant, which, according to the World Health Organization, has now been detected in almost 100 countries. Russia posted record high deaths for 5 straight days until Saturday, and Indonesia, having implemented a partial lockdown over the weekend, has also been seeing record highs in daily infections in the past week or so. And here are some of the latest increases. We just talked about Indonesia here with 27,000 infections, similar in the UK and Russia. In Brazil, 27,000 is actually marking a decline. And India, at 30.5 million cases, the origin of the Delta variant is now seeing some 40,000 new infections. And the total number across the world stands at 184.5 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Aside from the medical staff assigned with the task of inoculation, there are many more behind the scenes working to ensure that the vaccination campaign proceeds as planned. Now, we have details on that in this next report.
This is a vaccination center in Seoul's Seongdungu district, which opened in April and has since administered more than 36,000 jabs. The center is manned by dozens of staff members working in shifts, and the resident pharmacologist fills one of the most important roles of anyone at the center. Chung Jae-min is a pharmacologist from Seoul National University Hospital who has been dispatched to the center to supervise the storage and distribution of vaccines.
거의 매일 야근을 했던 것 같아요. 아무래도 약사가 혼자 하고 조금 백신이 안전하게 접종되려면 제가 공부도 많이 해야 됐고 사소한 부분이더라도 약을 아는 사람과 약을 모르는 사람이 관리하는 건 그 관리의 한 끝을 좌우하는 부분이라고 생각하거든요.
Pfizer vaccines are normally kept in ultra-cold storage and are thawed on the day before they're scheduled to be used. Before they can be administered, a pharmacologist has to place the vaccine vials on a clean bench to inspect them for any defects or other anomalies. They're inspected once again after being diluted to ensure there's no foreign particulate matter and that they contain the correct dosage. Throughout this entire process, maintaining the proper temperature is the most important element in the storage of vaccines.
일정 온도를 이탈하였을 때 알람이 울리도록 설정을 해놨는데요. 핸드폰으로 전화가 오게 되기 때문에 저희가 근무하는 환경이 아니더라도 온도 범위가 이탈했을 때 그에 대한 대처를 할 수 있도록 되어 있습니다. 네, 사실 지금까지 온도를 이탈한 적은 한 번도 없고요. 네.
With Korea set to broaden its vaccination campaign in the second half of this year, this vaccination center is planning to add more workers like Chung to its growing staff.
저뿐만 아니라 저희 센터만 해도 되게 숨겨진 곳에서 일하는 분들이 되게 많거든요. 그래서 그런 분들이 항상 지금 국민보건 향상을 위해 힘쓰고 있다는 거 알아주셨으면 좋겠습니다.
Korea has launched new services to help the country's elderly citizens get their vaccines. But what about for those with serious illnesses and mobility issues, who do not have any family members or other guardians to assist them? What they need is a caregiver who will accompany them to the hospital.
안녕하세요, 어르신. 불골기 쳐드려서 미안하네.
아니에요.
네.
네, 오늘 컨디션은 괜찮으세요?
예.
감기 기운이나 열 같은 거 없으시고 말씀드렸던 신분증도 챙기셨어요?
예, 다
챙기셨어요.
돌봄 공백 어르신을 직접 찾아가 안내하고 거동이 불편한 독거 어르신에게 동행 지원 서비스를 제공하고 있습니다. 실제로 많은 대상자분들이 서비스를 받아 안전하게 백신 접종을 하였습니다.
These so-called hospital companions are certified caregivers who accompany the elderly to ensure they have a safe journey to and from the hospital to get vaccinated and treated.
본인이 들은 이야기가 맞는지, 본인 건강 상태가 괜찮은 게 맞는지 이런 것도 저희한테 다시 한번 확인을 받고 싶어 하시고 이렇게 심리적으로 의지하시는 부분도 있습니다.
필요 없는데 데려다주고 또 내가 잘 걷질 못하니까 또 팔도 잡고 걷게 되고 그러니까 그게 편리하죠.
The caregivers also help the elderly fill out health questionnaires and bridge any communication gap between them and the medical staff at hospitals.
어르신 다른 알레르기 반응 있는 거 없으시고
알레르기 있는 거 있으세요?
드시는 약 있으세요? 어떤 약 드세요, 어르신?
처방전 가지고 오셨다고.
Ms. Kim got her vaccine today without a hitch, thanks to her trusty caregiving companion. The collective effort of all these workers has helped ensure safe vaccinations for some of the country's neediest and most vulnerable citizens.
It's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Monday. As mentioned earlier, the Greater Seoul area is looking at tighter restrictions amid the recent rebound in daily infections. Up on the screen are the latest COVID-19 guidelines for both the metropolitan region and other regions across the nation. The outdoor mask mandate for those who have received at least one dose of the COVID-19 vaccine has been reimposed in Seoul and its surrounding area. But for those outside of this area, the outdoor mask mandate remains lifted. The outdoor consumption of alcohol has been banned after 10 in the evening here in the Greater Seoul area, while there is no such restriction elsewhere nationwide. The briefing's about to start. We'll come back to you afterwards.
First of all, our updates on the COVID-19 vaccination front. As of today midnight, the number of those who have received at least one dose stands at 15,347,000, which is about 29.9% of the total population, and 5,321,602 people have been fully vaccinated, which represents about 10.4% of the population. And in their 70s, we have about 87% of the people who have already been inoculated, and also by age group, we also have high vaccination rates among the senior-aged citizens right now. And as for the senior citizens, we are currently continuing to roll out our vaccines. And as for those who have given their consent to receive the vaccines, however, have not yet booked their COVID-19 appointments, vaccine appointments until tomorrow, you could also utilize the previous, the advanced booking reservation system, and you could also receive the Pfizer vaccines. And if you have not yet received your jabs, as for those who are over the age of 75 in particular, we ask you to get your jabs as soon as possible. And also those between the age of 60 and 74, those who have already been making the reservations of the COVID-19 vaccines, and also who have been seeing their booking being cancelled, we have also began the receiving of the reservations again. And also starting this month, you can also get the Moderna vaccines. And also as for the 158,000 people who are subject to the AstraZeneca vaccines, and about 82,000 people who are subject to the vaccination who are under the age of 30, they are also going to receive their vaccines starting from today. And next, the second dose for the AstraZeneca vaccine recipients. And starting from today, those who have already received the AstraZeneca vaccines starting from April. And also as for those under the age of 50, you will be receiving the Pfizer vaccine as for the second dose. And also the Pfizer dose, these eligible recipients of the Pfizer second dose is also those who have, they will also go to the designated hospitals where they have already been booking their COVID-19 appointments. And if you do want to get the AstraZeneca vaccine, as for the second dose, we will be giving out the AstraZeneca vaccine as a second jab, as for those, only for those who are above the age of 50. However, if you are under the age of 50, we ask you to receive the Pfizer vaccine as a second dose in accordance to the opinions and feedback given by our panel of experts. And starting from today, we also have 11 new vaccination centers being opened. And going forward, we will also open 4 more centers nationwide. And as a total, we will have 282 vaccination centers up and running in the future. And here are also our updates on the COVID-19 post-inoculation adverse responses. And the report rate of such adverse responses is about 0.49%. And about 95% of those cases are mild symptoms, or common symptoms. And also out of the percent cases. They were the AstraZeneca, the anaphylaxis suspected cases, and also death. And also we have the rates being 0.42% for those above the age of 80. And as for AstraZeneca, we have 0.63% and 0.2% for Pfizer and 0.46% for Moderna vaccines. And in Q3, we will also be rolling out the Pfizer and Moderna vaccines, which are the mRNA vaccines. So we would also like to take note of some of the adverse responses of the mRNA vaccines, mainly being the myocardial infractions. And if you do have any suspected cases and symptoms like difficulty in breathing or also increase in heartbeat rate or also the pain in the chest area, we ask you to go to the doctor as soon as possible. And we also ask the medical professionals to report to us if you have seen any patients. And we also have looked at the health conditions of those who have received the vaccines. And we have been looking at about 10,000 people who have already received the vaccine. And we will also do a similar analysis going forward. And as for the damage compensation team, for the adverse responses, they have had a round of 20 screening committee meetings, and also they have looked at about 340 cases of anaphylaxis and 1 death and 3 severe cases. And also as for the 104 cases of anaphylaxis, all of them have been confirmed to have correlation with the COVID-19 vaccine. And next, we also have some updates on the COVID-19 infection outbreak here in South Korea for the past week. And during the past week, our daily average domestic cases stand at 655, which is about a 33.1% increase from the previous week. And among them, 80% are clustered and concentrated in the capital area. Especially in the capital area, we have seen 531.3 cases on average. And mainly, we are seeing cluster infections breaking out at multi-use facilities like clubs and pubs as well as restaurants and so forth, mainly infecting the young population between the age groups of 20 and 30s. And our fatalities for the week stands at about 10, and we are also seeing a continued decline in the fatality rate. And for the past week, we also see cluster infections breaking out continuously at pubs and clubs and restaurants and so forth. And as for the indoor sports gyms and also cram schools, we are also seeing cluster infections breaking out as well. And here are some risk factors and responses, especially in the metropolitan area centering around those between the age groups of 20 and 30. We are seeing an surge in the number of new infections. And most of them have no symptoms, meaning that there is a delay in identifying the patients. And they also have a wide range of movement, meaning that they also could expose the virus to a large number of people. And as mentioned earlier, yesterday, we will be intensifying our monitoring for these cases in the metropolitan area. And also in July, we also are very much concerned of the spread of the virus from the metropolitan area to non-metropolitan area as well. And in the non-metropolitan area in particular, they also have lifted the restrictions and the attendance gap on private gatherings. And we are also going to take particular note of this as well. And to this end, related central ministries will continue to intensify on-site inspections. And also during the summer holiday period, we will also do a crackdown on the private academies which will be frequented by the nation's students. And in particular, in the capital area, area at enclosed spaces which are crowded. We ask you to get tested as soon as possible, even though you don't have symptoms after visiting such areas. And when you are visiting cafes or restaurants or clubs, we ask you to minimize the time of stay and also wear your face mask at all times, aside from the time when you are consuming food. And we also have some revision of the guidelines for those who have already been vaccinated. And as for the vaccinated people, we ask you to, we also advise that as for you have returned from abroad, or also if you have come into contact with other confirmed cases, we have been switching these group of people to active monitoring group. And we also ask you to get the PCR testing for twice, and these will be changed, and these are the revised guidelines. And as for these people, we are asking you to get the PCR testings if you are returning from abroad. And also as for the next 14 days after returning to Korea from abroad, we ask you to monitor your symptoms, and also you need to refrain from going to multi-use facilities as well, and monitor your symptoms as well, and also wear your face masks. And we will be expanding the scope of the fully vaccinated people. And if we have confirmed that you have received one dose in Korea and your second dose abroad, we will also include these people in the group of fully vaccinated people. And right now, we are seeing a decline in the number of new infections in the senior age group above the age of 60. However, we are continuing to see a large infections stemming from the young population. And to this end, we ask you to comply with the basic quarantine rules. And even if you have been infected, we ask you to wear your face mask at indoor spaces. And even in outdoor spaces, we also ask you to wear your face mask. Thank you very much.
전문가 초청 설명회를 진행하겠습니다.
Right, there was Seongdungu with Monday's afternoon briefing. So what did she have to say?
Well, let's start with the virus situation in the past week. The average of daily infections when it comes to domestic infections stood at 655, and that's a rise by around 33% from the previous week, and especially because over 80% of those infections occurred in the metropolitan region, and in many cases that's linked to younger people between their 20s and 30s. So Tong has stressed that as we are seeing these infections at high-use facilities such as pubs, singing rooms, and restaurants, that people should make sure to get tested if they happen to crowded places, because these younger people in many cases are showing no symptoms of the virus. And that's why she is encouraging testings. And also on the vaccination front, Tong mentioned that there are going to be 11 new vaccination centers with more people subject to vaccinations in this month, which includes the elderly people who missed their chance to get vaccinated in the first half of the year. And also she mentioned that because we are going to have more people getting the Pfizer shots, that if there are any adverse responses when it comes to inoculations involving mRNA vaccination, then if people are showing any heart problems, they should directly go to the medical facilities. Although so far we are seeing only mainly mild symptoms when it comes to adverse responses.
Right, and hopefully we'll continue to see mild symptoms only. All right, so thank you very much for that.
My pleasure.
지금 수도권을 안정시키지 못하면 전국의 방역도 이달 말부터 다시 본격화될 일반 국민 백신 접종도 결코 순조로울 수 없습니다.
무観客もあり得るということを私から明言しています。そしていずれにしろこのことについては5者協議で協議することが決定をしてますので。
The spread of COVID-19 here in this part of the world appears to be on a rebound. For more on the situation in Korea and in neighboring Japan, where authorities are looking to launch the Tokyo Olympics, I have Professor Chung Gi-seok from Hallym University. Pleasure to have you with us, Professor Chung.
Thank you for having me again.
And I also have Dr. David Kwak from Suncheon University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
Now, Dr. Kwak, despite the weekend factor, Korea's daily tally stood on the 700 level this past Saturday and Sunday. How do you assess the current COVID-19 situation?
Well, it's very worrisome. We continue to see the rise in the daily case numbers. Luckily, we're not seeing any further domestic cases of Delta variants that increased too much yet, but we're definitely seeing a huge increment in the increase of the numbers, especially among very younger generations. And I've spoken about this in the past week or so. I just had a recent chance to really pass by Gangnam district over the last week. And it was jam-packed with youngsters really enjoying their time. There are huge lines in front of restaurants and bars. And I sort of could have taken a guess that we're really hitting the point of strong complacency among ourselves. And also going into summer vacation periods, we're going to see a lot more people, not just in their really young generations, but I guess older generations that are still younger than 60 years of age. They're also going to start to visit their own places, start mingling socially and whatnot. So I'm very scared for our prospect of the country. But luckily, we're actually going into a monsoon season, which means that a week or two afterwards, I'm hoping that there would be a reduction in the increase of the numbers, and we'll hopefully get back to the lower numbers that we used to have. But we should make sure that definitely this does not coincide with the spread of the Delta variant, because once it does, it's going to be much speedier, and we'll have to fight against much stronger spread of the virus as well. So we should really keep a very careful eyes on ourselves right now.
Right, which is why, Professor Chung, authorities in response to the situation now, they have strengthened some of the social restrictions in the Greater Seoul area, including the wearing of face masks outdoors, even for those who have received one dose of the COVID-19 vaccine. What are your thoughts on this?
It's a bit disappointing for people like me who have completed 2 injections quite a long time ago. But as Dr. Kwak mentioned, the situation is getting serious until today. So I think that's a proper management for that. So mandatory mask wearing, both indoors and outdoors, will be continued for the time being. And the other one, the outdoor drinking restricted after 10 p.m. That's a very simple idea and will be effective. But when you press one side of the balloon, then you can see ballooning of another side, so the so-called balloon effect. If you prohibit drinking outdoor after 10 p.m., many people will get into an indoor, like motels and authorized facilities and etc. So that's a big concern about it. But we have to look after the daily tallies along with severity cases and mortality cases. The lower severity cases and lower mortality rate is good news. So if we can see the calm down of current outbreak, then we can move to a new 4-tier system.
Right. Now, meanwhile, neighboring Japan is also seeking to contain a raging outbreak in the capital city, with roughly 3 weeks left to the start of the Tokyo Olympics. For more on the situation in Japan, I have Professor Haruka Sakamoto at Keio University live on the line. Welcome, Professor Sakamoto.
Hi, thank you very much for inviting me today.
Right. Professor, the daily tally in Japan has been hitting above 1,700 cases since the start of this month. And on Saturday, Tokyo alone recorded over 700 new infections. What, Professor Sakamoto, is fueling the outbreak in the capital city?
Yes, it is true that the number of the newly infected people has been increasing recently, especially in the Tokyo metropolitan areas, such as Tokyo and then Yokohama. And then in Japan, similar to the Seoul, most of the newly infected are younger generation, as the vaccination of the older adults is already underway on a large scale. And then I think another factor is the problem of the Delta mutant strain. So this mutation is said to be more infectious than the previous one. And then in Tokyo, about 30 to 40% of the newly infected people has already been replaced by the Delta mutation. And then I believe this mutant strain in partly contribute to the recent increase in the Tokyo areas.
I see, which is why, Professor, the authorities there, I believe, are thinking about extending the quasi-state of emergency that is slated to end this coming Sunday in the metropolitan area. What are your thoughts on such containment efforts?
Yes, a majority of the experts propose to extend the state of emergency because of the current situation in Tokyo. Actual number of the infection is currently increasing. So most of us think that this is not the timing to lift the state of emergency. But I think one of the major points is that we will have an Olympic game in the 3 weeks. And then actually every day we are welcoming the many athletes from all over the world. So the balance between having an Olympic game and an infectious disease control, there's a quite very difficult political decision. So this is because not purely the infectious disease control perspective, but mainly this decision by the political aspect.
I see. Professor, you mentioned the vaccination campaign in Japan. Is it picking up pace?
Yes. So the Japan is no way behind compared with the other high-income countries. But recently, I think the vaccination campaign are going quite well. So at the present, the number of doses per day is about 1 to 1.2 million per day, which is very high compared to the other countries in terms of the doses per population. And then in Japan, we are currently using only Pfizer and then Moderna messenger RNA vaccine. And then once these are imported in Japan as scheduled, I think the vaccination will continue to proceed smoothly.
Right, hopefully that will be the case. Meanwhile, Dr. Kwak, I believe you have a question for Professor Sakamoto.
Yes. Well, thank you for sharing your time with us, Dr. Sakamoto. I just had a personal question. Korea has been recently promoting maybe incentives to the people who received vaccines and who are to complete their vaccines. I was just wondering if the Japanese government is also implementing these incentive programs to people who are about to receive the vaccines. And also, I just had a personal question. If you had any ideas or ideas to suggest what further other sorts of incentives that the government could offer.
Okay, yes, thank you very much for the question. So the vaccination used to be administered by the local government where people are living. But now vaccination campaign are starting at the universities and in the workplace. And then this is a quite big incentive, especially for the university student and then also the people in the working population. And then because of this, starting in the workplace and the universities, the spread of vaccination is further accelerating. However, there's no campaign or no incentive to give something if people get the vaccination as seen in the other countries. However, this is my personal opinion, but considering the characteristic of the Japanese population, I believe that if everyone surrounding you start to be getting vaccination, I think the more people start to think that they will also be vaccinated. So the answer to your question is that there's no such campaign. Yes, but the vaccination campaign gradually started, not only the local government, but also the working place and the universities. And then because of the characteristic of our population, I think the more people will soon be vaccinated. But I personally, it would be a good idea to provide any incentive, like the meal coupon or providing any goods and commodities if the people get vaccinated. Because currently, this is a not huge concern, but some people are still hesitant to be vaccinated because especially for the messenger RNA vaccine is a quite new technologies. So some people are still concerned about the getting vaccinated. So I think it is very important to give any incentive for those people.
Right, I see. Meanwhile, Professor Jung, do you have a question for Professor Sakamoto?
Yeah, Dr. Sakamoto, good to see you. I'm a pulmonologist and quite concerned about the spreading of virus during your Olympic season, particularly among the spectators in the stadium. Because I heard that in the opening ceremony you are allowing all the audiences over there. So what's your policy over there? And I also heard that many medical doctors over Japan are concerning about Japan government's policy on the quarantine So what's your, do you usually advise, including other specialists, to Japanese government on the quarantine policy?
Yep, thank you very much for the question. Yes, so the advisory board to the government issued a proposal for the Tokyo Olympic Games a few days ago. And then it includes, the majority of the panel includes the public health expert and the medical expert and infectious disease control expert. And then I think there is a general consensus among the experts that we should have an Olympic Games without spectators. And then actually the panel recommendation, the expert panel's recommendation also emphasize that we should have the Olympic Games without spectators. However, as I mentioned in the earlier today, because to have the spectators or not having the spectators, it is not a purely decision by the infectious disease control perspective. Rather, the government needs to care about other aspects, such as the sponsors of the Olympic Games. So this decision, of course, I personally, as a public health expert, I believe that Olympics should be held without spectators, but I think this decision largely depends on the political aspect.
Right. Professor Sakamoto, do tell us a bit about the entry protocols at airports for Olympic-related people into Japan.
Yes, so the Tokyo Olympic Organizing Committee make an agreement with an IOC, International Organizing Committee, and then provide vaccination for all the athletes. And then we encourage, government encouraged all the athletes to be vaccinated before coming into Japan. And then also encouraged all the athletes to get the daily PCR testing before they coming to Japan. So those who were coming with the endemic areas, we encourage to the daily PCR testing 7 days prior to the coming into Japan. And then also after arriving into Japan, we also conducted an antigen testing and then also PCR testing for those athletes. But but still we have some positive case every day. So yeah, it is another concern that how we can prepare for the isolation phase and then how we can strengthen the kind of quarantine process, because we are welcoming a huge number of the athletes. So even we encourage them to conduct the PCR testing every day and then provide the PCR testing on their arrival. But yes.
Right, it's still going to be a tough task. All right, Professor Sakamoto, thank you very much for your thoughts and your time.
Yep, thank you very much. Thank you.
Right.
Thank you very much.
And back here in the studio, Dr. Kwak, our second half vaccination drive will be headed by Pfizer and Moderna vaccines. We're also looking at the launch of cross-inoculations in the second half. What more can you tell us?
The biggest factor that was implemented starting of this month was that people who are younger than 50 years of age are no longer to be allowed to receive AstraZeneca shots. So those people who received for their first shot in AstraZeneca now will be offered a cross-matching shot with Pfizer shot instead. Except for 120,000 people who were originally inoculated with AstraZeneca, who are still above 50 years of age and who work in the medical forces, such as in nursing homes, and those who are helping those people. All other people will now be only allowed to receive mRNA-type vaccines, including Pfizer and Moderna. It seems like going into second weeks and third weeks of July, they're going to start jabbing people going into military service, and they also have plans to inoculate the seniors of high schools who are about to take their college entrance exams. But also people who were cut short of their first shot because of lack of the AstraZeneca shots in the first half of the year, even for those people who are still above 60 years of age, now will be offered actually Pfizer shots instead. So anybody who is being allowed to receive the shots, it seems like will be allowed mRNA-type vaccines in the second half of the year.
Right. Professor Chung, social restrictions were extended in the Greater Seoul area, as we mentioned earlier, despite their ease elsewhere across the nation. And there are high expectations for the extension to be made further. What are your thoughts?
I don't know right now, but as we have experienced, not only in Korea, but also all over the countries, tightening of social distancing leads to a lowering of occurrences. And In the contrary, easing the social distancing level, then you can have outbreak over there. So it all depends on the government policy, how to survey the violation, and how to impose the penalty on people who are not obeying, who are not abiding by the regulation. So now I think it's time to discriminate people who have been obeying or abiding by the rules, and who are not, who have been not. So I think that will lead to a protection of our society and protection of the people who have been obeying the rule and following the quarantine policy so far. If not doing that, just only 1 week or 2 weeks extension of the current social distance system will not prevent particularly the Delta variant virus to be spread in this society.
I see. Dr. Kwak, the number of imported cases is also on the rise here in the country, with those arriving from Indonesia accounting for a large portion. What are your thoughts on our current containment efforts at the airport?
Well, they're adjusting to the numbers that are happening from overseas. So I think the government already started implementing a new regulation towards the people who are coming in from Indonesia, that they are now only allowing about 60% of the seats in the planes are to be occupied from to the people that are coming in from Indonesia. And also, I think they've actually stopped allowing for the people to have visas coming into the country. So they're trying to best to minimize any intrusions, further intrusions from the pandemic and endemic areas that are highly contained in the Delta variant. I think the government still knows that it is quite inevitable that we are eventually also going to get dominated by the Delta variant, but the government is still doing its best to delay and sort of slow down the process so that we can better prepare ourselves before it actually hits us. So it'll also be implemented to other countries that are to be hit hard with the Delta variant. But as domestically speaking, all we can do right now is really protect ourselves by keeping the social distancing guidelines, but let the government do its job.
All right. Professor Chung, greater autonomy has been granted to regional authorities to decide on their COVID-19 measures. What are your thoughts on this move?
I agree with the policy. The central government will give regional government more autonomy and more responsibility. Because it's already been 1.5 years have passed since the outbreak of COVID-19 in this country. So many officers serving in local government are knowing from A to Z. So if they are in response and they are in responsibility, then they can pick up the most vulnerables in their own region, where the central government wouldn't know that. So most vulnerable people, most vulnerable establishments in their own society, own region, will be covered first, and in a very prompt and effective manner. But another worrying thing is because having said that, the experience or the knowledge in the officers and in the local governments will be less than EIS officers in KDCA. EIS means Epidemic Intelligence Service. They are well trained and they have been in that work for quite a long time. So if they are lacking knowledge in regional government, they can easily do some absurd things against quarantine policy. And another thing I'm worrying is the local governments is connected by another local governments. So one government is going to this direction, and the neighboring government going the contrast direction, then the coordination should be needed. So in that case, the master in the orchestra should be on the podium, like Commissioner KDCA and etc. So the coordination should be performed, but I mostly agree with the policy that autonomy and responsibility in the local governments.
Right. And Professor Chung, what conditions do you think need to be met before we ease social restrictions here in the Greater Seoul area?
Well, first of all, the total number should be lower than 250. That's the criteria of new four-tier system, level 1. But the level should be far lower than 250 because the new system level 1 is, I think it's very low restriction. So you can meet anyone. You can drink and eat anytime. So all you need is keeping your personal hygiene, personal quarantine measure. So if level 1 is applied with, for instance, 200 and so, then we'll see a rapid increase above 250, and then we move to a level 2. So I think that the level should be very low, around hopefully 100 or less than 200. And of course, medical facilities will be available anytime. If you can see an increase of severe and very severe cases, and you can see a tendency to increase the mortality, then you never get the level down.
Right. All right, Professor Chung, as always, thank you very much for your thoughts. And Dr. Kwok, thank you for being with us today.
Thank you.
Right, that brings us to the end of this edition of COVID-19. The mask mandate has been reimposed here in the Greater Seoul area, so do remember to adorn your face mask wherever you go, whether indoors and outdoors, of course. Thank you for watching.